If the patient complains that when she's hungry, sneezes or laughs, urine leaks out involuntarily. This is called stress urinary incontinence because all these things increase the pressure inside the abdomen. As for urge urinary incontinence, the patient feels a sudden or urgent need to go to the bathroom. And before she reaches the bathroom, a drop or two may leak out, or sometimes all the urine may come out. Peace be upon you. Today I will talk to you about urinary incontinence in women. But there is more than one type of urinary incontinence in women, and in order to treat urinary incontinence properly, we need to identify its type accurately, because each type of urinary incontinence requires a different treatment. The first type of urinary incontinence in women is stress urinary incontinence. This is a type of loss of bladder control. It happens when the pressure inside the abdomen increases. So when the pressure inside the abdomen increases, it presses on the bladder and a drop or two of urine may come out, or sometimes all the urine comes out. What causes this? It is caused by weakness in the pelvic muscles that support the bladder. So when the pressure inside the abdomen increases, the bladder drops down, causing urine to leak. What causes it? The most common cause, in fact, is repeated natural childbirths. This puts pressure on the pelvic muscles and causes the stress urinary incontinence we just mentioned. The second type of urinary incontinence in women is urge incontinence. Urge incontinence is when there is a sudden, strong urge to go to the bathroom. What causes this? What is the reason behind it? It is caused by involuntary contractions of the bladder muscles. These contractions can be so strong that they allow urine to leak out without any movement. So, these involuntary contractions give us a constant urge to go to the bathroom, and when the contraction is strong, urine may leak out without us being able to control it. So how do we diagnose these two types? Or how can we tell if we have stress incontinence or urge incontinence? The first thing is through history, by talking with the patient, and we can figure out which type they most likely have, or if they have both types together, because sometimes some women have both types at the same time. If the patient complains that when she coughs, sneezes or laughs, urine leaks out involuntarily, this is called stress incontinence, as we agreed, because all these things increase the pressure inside the abdomen. As for urge incontinence, its symptoms are a bit different. The patient feels a sudden or urgent need to go to the bathroom, and before she reaches the bathroom, a drop or two might come out, or sometimes all the urine may be released. So the symptoms of this type are completely different from the symptoms of the other type, and the treatment for this is also completely different from the treatment for that. By taking the patient's medical history, we can direct our diagnosis toward a specific direction. After that, we start the treatment. So what does the treatment for stress incontinence involve? Its protocol is as follows. First, our target is to strengthen the pelvic muscles so we can restore the bladder to its natural position, so that when there is pressure inside the abdomen, the bladder doesn't drop down and cause urine to leak. So the first thing we start with is exercises. What are these exercises? They are Kegel exercises done multiple times. These are exercises aimed at strengthening the pelvic muscles. So how long do we continue with them? We continue these exercises for 3 months. After 3 months, if the exercises don't work, we do a test called urodynamics. We perform this test to make sure there are no disorders in the bladder muscles. And if our diagnosis is confirmed as stress urinary incontinence, a minor surgery is performed. This surgery involves placing a tape under the urethra. This tape lifts the bladder up and reduces stress urinary incontinence. It prevents the bladder from descending. When the bladder tries to go down, the tape lifts it so stress urinary incontinence doesn't occur. That's regarding stress urinary incontinence. Now for urge incontinence, which we agreed is due to a disorder in the bladder muscles, we use medication. This medication reduces bladder contractions. But first, we must make absolutely sure that there is no infection, because the most common cause of bladder muscle disorders is an infection in the bladder wall and inflammation of the bladder wall. This causes irritation of the bladder wall and leads to the bladder muscles contracting in the way we discussed. So we need to make sure there is no infection, and after that we can give treatment. This treatment reduces bladder contractions, and we will continue it for 3 months as well. After the 3 months, if this treatment doesn't work, we also perform a urodynamic test to be able to identify these contractions and see them ourselves on the device, and to see how strong they are. That is how much these contractions increase the pressure inside the bladder approximately. And based on the result of the urodynamic test, if we confirm that there is a disorder in the bladder muscles and the patient is not responding to treatment after 3 months, we inject Botox into the wall of the bladder. This Botox is just like the Botox we inject in the face for cosmetic purposes, but we inject it into the bladder muscles to reduce their strong contractions that lead to urinary incontinence. In the end, I hope you benefited from the video. If you did, please like and subscribe to our channel so you can get the rest of the videos. Peace be upon you.